So that should pretty much cover the different strikes and gaits that you would use barefoot running and hopefully prevent some injuries. If you're just getting into this, take it slowly. Don't try to do 10 miles your first day. Stay very focused on the trails. I'm not recommending that people get on the hard surfaces and run on roads and sidewalks in barefoot running shoes, at least not in the beginning and not for quite some time. Most of my triathletes are cross-training. They'll do a little bit of it on the road and barefoot. Be careful with some of the shoes that are running shoes that are coming out that are with a negative heel that are tipping backward. If you're going to use those, be very careful because that's creating some of the Achilles tendon injuries in our office that we're seeing if people are being too aggressive with those type of shoes. One of the other considerations that can cause injury when running is a leg length inequality. We develop and our bones grow, and sometimes at the end of the day when we are skeletally mature, the bone length in the legs is not even. And when that occurs, if a person is running and has a 1/4 of an inch shorter right or left leg, or 3/8 of an inch or even more, they are essentially running and stepping into a little 1/4 or 3/8 inch ditch wherever they go, pounding down and lifting up, which is probably why we'll see one-sided joint degeneration in knees and hips as a person gets older, and they wind up having to replace those joints on the long side typically, and the shorter side tends to have less degenerative changes. You'll also see foot degenerative changes, more compression of the arch, more bunions on the longer leg if that does occur. So if you suspect that you have a leg length inequality, you would want to get that checked out by someone that's qualified to do so. You may have a leg length inequality if you find that you consistently stand with one leg flexed all the time, or as you're putting on clothes, you notice that one cuff tends to reach lower towards the floor, and or you have one-sided knee or hip pain or one-sided foot pain fairly consistently. And we have a discussion of that coming up here in a later video, and feel free to watch that. Again, Dr. Sean Phelan with Wake Forest Chiropractic. Good luck with your running.